Back in 2013, across the City of Leeds, we undertook an end-of-life care health needs assessment. And one recommendation that came from that assessment was that there was a lack of provision of hospice-style care for patients who had simple needs but who wished to die in the hospice. We took that on board, and here at St Gemma's we developed a project to pilot 4 nurse-led end-of-life care beds. So these beds are intended for patients who have a very short prognosis but who lack the level of complexity required to access a specialist palliative care bed here in the hospice. There is a national recommendation that patients should be offered choice at end of life, particularly choice around where they spend the last days of their life. And we were worried that some patients didn't have full access to hospice as a preferred place for their end-of-life care, and we wanted to redress that issue.
The patient and the family will get a very detailed, impeccable assessment of what their needs are. They will be assessed in the round, so holistically, for all of their requirements. They will have expert symptom management. They have access to the medical team, should they need the medical team. And they will be in an environment that is designed for their needs, so for end-of-life care.
I think St Gemma's has a great reputation for its end-of-life care. So we have specialist nurses who are highly trained and skilled. We have a beautiful building which is well equipped for end-of-life care. We've got good facilities for families to stay if they wish to do so, which helps the patient in terms of feeling more at home. We have a beautiful garden, and even patients as unwell as the patients I admit into these beds still can see the benefit of being able to look out into a garden, and actually we can push a bed out there if a patient wishes to spend time in the fresh air.
We offer complementary therapy both to patients and their loved ones. So this can be things like Reiki, or it can be a foot massage or a hand massage. And then we offer bereavement support. So we do pre-bereavement support, and we also do post-bereavement support, which is often very beneficial to the families. We have a spiritual care team here within the hospice, and they are able to talk to patients about religious needs, spiritual needs, or just lend an ear to talk about their concerns about the future.
It's about making sure we understand what's important to each family and the patient at the centre of our care, and we work as a team to try and meet those needs.
We met a 90-year-old lady who'd unfortunately suffered a large stroke, and her nursing home where she lived were unable to manage the seizures, the fits that resulted from that. So she was admitted to the acute hospital as an emergency. Over the next couple of days, we made her very comfortable, her symptoms were well controlled, but it did become apparent that she was in her last days of life. And she was very clear, as were her family, that she'd never wanted to die in hospital. It's a wish that she didn't do that. So we were able to phone Catherine, the nurse consultant at St Gemma's, and very fortunately she was transferred within a matter of hours to one of the end-of-life care beds there.
I had a patient that I was looking after in the community. Unfortunately, she wasn't able to stay at home because her husband went into hospital. So she did go live with her sister. Although she was deteriorating, she did feel that her sister was really struggling with looking after her at home because she didn't want her to die in her house. So the opportunity of having an end-of-life care bed within the hospice was great, because we were able to bring her into the hospice, and also we were able to facilitate her husband coming from the hospital in the last few days of life to see her, which probably we wouldn't have been able to do if she was at home.
Recently we had a patient that was with us who was in one of the end-of-life care beds, and when we asked if there was anything that she wanted, she said she'd like to see Frank Sinatra, and she was a very poorly lady, and this was something that we thought we would be able to sort out before the end of her life. So we managed to get a Frank Sinatra tribute act to come in, and he gathered round her bed and sang loads of songs to her, and she absolutely loved it, and it was sort of the first time that she probably smiled with us and laughed, which was fantastic to see.
We felt completely at ease and relaxed and felt that our friend was being well looked after.
And nothing was too much trouble for the staff. And I mean, they have a heavy workload because there's not just one person that they're looking after, but yet you felt as if you were the only person that mattered while they were dealing with you.
The nurses are number one. They are of good quality. They are well trained and experienced.
I'm still as ill as I was even in the LGI, but I feel safer here. Because as soon as you've got a little pain or anything, you press your buzzer and they're there. And they do say to you, don't keep yourself in pain. Whatever it is, Elaine, just press that buzzer and we'll be there, and they are. And they're lovely. And they've got a lovely bedside manner as well. Nothing's too much.
I think it's a place of peace and love, and the staff, all of them, from the cleaners up to whoever runs the place, are all in one mind that the quality of life that the patients have left should be the best quality that they can give them. And I felt that was very true, not just for Edna, but for the people who loved her as well. It's just a blessed and peaceful place.
Whenever we're trying to improve services for patients, it's absolutely vital that all the relevant organisations and individuals that will make a difference are involved from the outset and throughout the process. And we do feel the Acute Trust has been very involved with the End of Life Care Steering Group at the St Gemma's project. Our contributions have been respected and incorporated in the plans. Been very well briefed throughout, communication's been very good, and the evaluations have been shared as they've gone along. So all in all, a very positive collaboration.
It's mainly relatives that I've spoken to whose family member will have accessed the service of the end-of-life beds here at St Gemma's. And I think there are a number of things that they repeatedly say. One is that they're in a very different environment than perhaps being in an acute hospital ward, or indeed, being at home where it may have been very challenging. So they're in a different environment, which means that often it's a bit more contained. There are less anxieties because a lot of the challenges are being met, in terms of pain and physical care and those sorts of things. And also, support for the relatives themselves. And I think that it is very different from an acute hospital. This is very much about a more homely environment and a more peaceful environment, which is sort of designed specifically for people with advancing disease and for people who are dying. So I think, all of that combined with the fact that there is an expert nursing team and there's a medical team that sits behind them, provides people with a really excellent level of care.
The feedback we've had has been really excellent and we've been really pleased with it. Patients have commented on the ability of our staff to communicate well with them. They've been really impressed with the quality of care delivered and they appreciate the beautiful environment that we have here. They've enjoyed the garden, they've enjoyed the space to spend time with their loved ones with privacy and space to do that. We've been talking to families about their experience. And again, it's been really positive. So we send all the families of patients that we've cared for in these end-of-life care beds a questionnaire. And what it tells us is that families have been very satisfied with our ability to manage pain and other symptoms. They've been impressed with the level of communication and information that we can provide, which is really important for families at this time. We've also been talking to our staff about their experiences and again they've been really positive. So the staff are proud of the high level of end-of-life care that we've been able to deliver. I think the nursing staff feel that they've upskilled, so they have developed their communication skills and their general knowledge around end-of-life care. And we've also enjoyed the team building aspect, so we've worked together to develop a new service and the nurses have enjoyed being part of that.